Wonderful. Good afternoon, everybody. Okay, that was a fair response. Let's try again. Good afternoon, everybody. All right, okay. Let's get that energy up. So I want to say welcome to everyone in the room with us and also those of us that are participating virtually. Such an exciting session and lots of great information we have in store for you. I'm pretty biased, but I think it's going to be the best of the day. I am Lakeisha Muhammad. I serve community as a home birth midwife. I have over 20 years of experience working in maternal health, and many of those years was spent as a hospital doula, working right alongside families here at local hospitals. So this subject is near and dear to my heart. So how exciting is it that we get to sprinkle some doula magic here in our state? I'm so excited about it. Yes. So we know, just to level set a little bit, a doula is a trained professional who provides expert guidance for the service of others and who supports other people throughout a significant health-related experience. And today we're talking about that guidance in the area of childbirth. We know it has been scientifically proven the effects of doulas, the positive effects of doulas on the childbirth experience. So that is increasing the satisfaction of parents throughout that experience, as well as clinical markers. So we know less C-section, less intervention overall, and just a greater outcome for particularly families that are significantly affected by the disparities that we know exist in maternal health care. So I want to say this in the beginning versus the end because I don't want it to get lost. I shared with our panel that not only here in Arizona, but across the country, doula coverage through Medicare or state-regulated doula coverage is somewhat of a controversial topic, right? People have big feelings and big emotions about this topic. So I want to express gratitude to our panel for your courage and your willingness to come forward and share and clear up a lot of maybe misinformation and just make very, very clear what's happening here in Arizona to bring the ability to bring that doula magic to more families that are in need that it would greatly impact. So that's what we're here to do today. And to help us better understand this vital topic and process, from the Arizona Health Department, we have Casey Miller. Let's go ahead and show her some gratitude. Thank you, Casey. We have Megan McMinn from our Access Healthcare System. We have Rachel Sally. And representing folks near and dear to my heart, our hardworking, dedicated community doulas, Amelia Garcia. We don't have a lot of time and we have a lot to cover, so we're gonna get into it as we get into it, right? We're gonna start with our ADHS team who are gonna take us into a better understanding of the 5 pathways to certification. So not all of us know, but this system, this certification program, with the help of our Doula Advisory Committee, which Amelia was a part of, thank you for that work, have come up with a system to certify doulas. And it's broken down into 5 pathways that individuals from our community can utilize in order to become certified and thus eligible for reimbursement. So Megan, Casey, take it away.
Hello, thank you all for having us. We're excited to be here. We're gonna go ahead and just talk about, obviously, we had an introduction about licensure process as well as the 5 pathways of licensure for doula certification. Casey's gonna go ahead and start talking and reviewing just the basic application requirements, and then later I'll be talking about the pathways.
So next slide, please. And one more. So for our doula For our doula licensure, all of our applications require a few things, so I'm going to go through those requirements first. We need some basic personal information that's all asked for within that application, so name, date of birth, address, those types of things. We also require a signed high school or high school equivalency attestation demonstrating that you completed high school, and a signed doula code of ethics agreement. So this code of ethics agreement was crafted by our doula advisory committee, and it just gives a set of outlines of how a doula should be providing services to their community. We should also receive proof of certification in first aid and CPR through a course recognized by the American Heart Association. That is a statutory requirement. So any CPR certifications must be through courses that are recognized by the American Heart Association in order to qualify through this application process. We also require a valid fingerprint clearance card as required by statute. And we also need an image of citizenship or authorized presence document demonstrating that the applicant is at least 18 years of age or older. So for this, we're looking for example, Arizona driver's license, and a passport always works for this as well. All applications also require a non-refundable application fee of $100 plus an initial license fee of $200. Those fees can be paid via cashier's check or money order and are made payable to ADHS. We also have a fee waiver available for first-time applicants if they meet one of the following qualifications that are listed here. So you'll see those three. One of them is individuals below the 200% of the federal poverty guidelines, active duty military spouses, and veterans who have been discharged within the last 2 years. So lastly, the requirements for all applications include a completed and signed statement of citizenship or alien status form, which is included within the application. And if for some reason your legal name differs from the documents that you're submitting, you must provide a name linkage document such as a marriage certificate or a divorce decree. And if you have had any disciplinary action on a previous license or certification, or if you are currently ineligible for licensure in another state, you have to submit supporting documentation for those cases as well. So this concludes the requirements for all initial applicants. Up next, Megan's going to review the specific pathways that qualify you.
And before Megan begins, I was remiss, I didn't mention that everybody here has received a handout that outlines the information that Casey and Megan will be sharing. This handout is also available through the Hoover app for our virtual participants.
All right, so next, oh, there you go. That's a perfect slide. Pathway 1, you're going to see those first 2 bullets actually are repetitive as we go through each of the pathways. So pathway 1, this one requires 3 verified births where you served as a primary doula, which is supported by evaluations from both the laboring mother and a healthcare provider. You must also provide proof of 30 hours of in-person or a combination of in-person or online instruction with that, which includes the core competencies. And then the next slide, pathway 2 is for applicants who are already certified by a nationally recognized doula organization. And then you can see those same 2 items at the top kind of are standard through most of these pathways. Okay, so next one. All right, this pathway 3 involves similar requirements, but includes community training in non-Western doula practices and core competency training through culturally specific education. And then pathway 4 focuses on individualized and experiential training combined with core competency education. And finally, pathway 5 is for those doulas that were practicing 5 years before September 28th at night. And this requires, there we go, I'm back again. I don't know where I ended. So this is for, just to repeat, the doulas that were licensed 5 years before September 29th, 2021. This pathway requires individuals to provide letters of recommendation from healthcare professionals who have worked with them in the past 2 years.
So as you notice, we listed a lot of supplemental forms, right? The department did create forms to go along with this application process in order to make it easier for applicants when they're filling out those applications. Typically, if we create a form that gives you an outline of what we're looking for, it makes it easier because then you aren't just trying to guess and throw spaghetti at the wall and see what sticks and what we're willing to accept and not. So by creating these forms, we really streamline the process so that you're able to provide us with that specific information that's required by statute and rule. So I'm going to go through these really quick. We've got the Code of Ethics Agreement, the high school equivalency attestation, birth observation form, primary doula attestation, the competency attestation, and letters of recommendation form. And on the next slide, this is a screenshot specifically from our website. So when you go online at azdhs.gov/BLPO, you will find this list of application information along with links to all of these forms. So it makes it easy for you to determine which forms you need based on the checklist that you're using to know which items to print out, fill out, and send in to us.
Okay, so now we're just going to review very briefly the requirement of a fingerprint clearance card for application for licensure. Go ahead and go to the next slide. Thank you. This is a statutory requirement. We often have calls from doulas that are on our website and are frustrated trying to find out how do they get the fingerprint clearance card, and we direct them. We do have a section in our FAQs, they're called, where it gives you all the links and everything you need to know for where to get a fingerprint clearance card through the Department of Public Safety, also known as DPS. That's where you can go ahead and apply. And we have a big win. We had a bit of a barrier when we went live with this program, and that was that whenever you have a program that statute requires a fingerprint clearance card, you have to have approval from the FBI for DPS to go ahead and list that category on a fingerprint clearance application. And it took a bit of time for that approval to be provided from FBI. And then FBI has just last month approved it. DPS has that notification, and DPS sent us a notification that within 3 weeks they should have that category available on the application. So we're very excited about that. And that is supposed to be going live hopefully within the week, possibly next. Okay, so the other area is just real brief, our website resources. And so when you go on the Doula website, you can see all of our resources there. There's the application checklist, the approved schools, statutes and rules, advisory committee, all the documented meetings that we've had from that, agenda items, so on and so forth. Go ahead and go to the next slide. And then we're going to be wrapping it up with just, this is on our website. This has the approved programs for doula licensure. This is actually just a screenshot. It does scroll down to many more options. So those going for licensure through different pathways can go ahead and see which schools provide that. All right, and then there's our contact information. It was a pleasure to share this with you. We have a whole team of people that are available to answer calls all day. If you need support with an application or any questions you have regarding licensure, that is our contact information and phone number. Thank you.
One word from the audience that I'd like for y'all to help us clear: attestation. What does that mean?
So an attestation is a form, you know, like I attest that I blah, 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 right? So an attestation, in this case, we have a high school equivalency attestation. It's a form that says, I attest that I have graduated high school. It was a way around us asking applicants to provide their high school diplomas Who knows where that is,
I don't know
right?
where mine is.
Since we are required to get proof that you graduated high school, if you can provide us with an attestation saying, I hereby swear that I definitely graduated high school, you sign that, you turn it into us, we are able to fulfill that legal requirement per statute and rule. And then you don't have to go digging in your parents' closets for documents that you don't know
They're
where
sure to
you would have put them.
gatekeep it, right?
Yeah,
Thank you,
exactly.
Casey. Our next question is for Miss Amelia. I noticed pathway 3 points to traditional training amongst community members and not so much the formal doula training that one might seek out. How important was it for you as a member of the Doula Advisory Committee to make sure that that was included in the pathways?
Oh, can you hear me? Okay. I thought it was very important to include such trainings because as an Indigenous person, I did take DONA training, but it didn't speak to me the way Indigenous training would speak to me. So we did make it a point to have more than just a few organizations be on that list. And for that reason, you know, Native culture is very different. And so it's very important to be recognized in those birthing traditions as well.
Yes, thank you for that. I know my organization, Arizona Birth Workers of Color, helped also to flesh out that list of approved doula trainings or approved doula pathways, I guess we could say. So thank you for that, Amelia. So we'll now turn to the finances of it all, and we'll talk about the reimbursement piece that is attached to the doula certification within our state. And to help lead that conversation, we have the hardest working lady that I know, Miss Rachel Sally.
I'm going to stand here because I can't really see the screen from my chair. So I'm going to talk to you a little bit today about access coverage of doula services and how that's different from becoming a certified doula and how they kind of work together. Well, first slide. So just a really quick background on access. And the reason I'm putting this in there is because one of the reasons that I think the certification versus access enrollment gets confused is because a lot of people don't even know that ADHS, the Department of Health, and Access are two different agencies. In some states, they're not. It's one big, you know, Health and Human Services or something. And we all recently changed our agency logos, which made that a lot worse. Because if you noticed from theirs, it looks almost exactly like that one at the top. We used to have that little sunshine, our slide deck hasn't been updated yet. So that probably isn't going to help that problem. But in contrast, what ADHS does, Access, our state Medicaid agency, cover over 2 million individuals. We cover over 50% of births in Arizona. I highlight that to bring up the point of how relevant it is that we're covering doula services and how many people it can potentially affect. We use federal, state, county, and other funds to fund the coverage for these services. It's not nearly enough, but that's what we got. And we talked a little bit earlier about managed care and how that works. So we have contracted health plans that are responsible for actually delivering the coverage. So they do a lot more of the direct to member and direct to provider communication and working, and we're kind of the oversight agency. The one exception to that is our American Indian Health Plan, which is a fee-for-service plan. People who are American Indian, Alaska Native get to choose between being on a managed care plan or being in our fee-for-service plan. So that would allow them to see any provider that's Access enrolled, regardless of which plans they may be credentialed with. But that's the only exception. Everyone else is required to be within managed care. And the reason I'm highlighting a few of these things from our strategic plan is primarily that top right one there about preventive care. This is super important. A lot of people think of medical coverage as just covering treatment for disease or illness, but we also cover preventive care services, and there's some more guardrails around that I'll talk about a little bit, but I just wanted to highlight again how this is really relevant to Access's mission. And Lakeisha talked about a lot of these, so I won't go through each of them, but to that point about prevention, doula care is evidence-based prevention, right? Doulas are not there to treat a disease or to make an illness go away. They're really there to prevent some of these negative outcomes and to help birthing people and their families just have a better experience overall. And, some of that evidence base can be seen in research with increases in breastfeeding, initiation and duration, having a better birthing experience and better emotional well-being. One that I thought was really interesting that I found was higher car seat utilization at 3 weeks, I believe it was. And I think that's interesting because it's not necessarily intuitive, but if you think about it, doulas are support people, right? They're there to provide support to a birthing person and their family, and that can be educational support, emotional support, physical support. It can be helping you connect to resources. So this education might help families understand how important it is for their kids to be in a car seat, in the right car seat. It might help people find a car seat, particularly if they're having difficulty affording one. So it really does, if you think about what they do, it makes sense. And we also know that these benefits, as Lakeisha also said, are even more significant for individuals at the highest risk of poor birth outcomes. And we know that, that's a lot of our parents, and a lot of them might live far from a healthcare provider. They might, have resource needs or other health related social needs that doulas can provide help for. Now I'm going to talk a little bit about how we were able to cover services. This, varies so much, and it's so complicated depending on what we're trying to cover and what we're trying to do. But for the purpose of being able to cover doula coverage, we submitted a state plan amendment, or a SPA. So the state plan basically assures that, Access is providing XYZ services. And the first one, I think, was in 1982 when Access was born. And anytime we want to change that, we submit a SPA. The SPA, you can see our timeline there for doula coverage specifically. So first, it was a matter of an internal Access work group. Once the doula certification process was in place from ADHS, because that was a requirement for us to cover a service, that there's some sort of certification or license involved. So we did a lot of, our planning of, what our policies might look like and how we're going to get this done, all of the financial estimates. And then on May 6th, that SPA draft went out for public comment as well as tribal consultation. And then the SPA was submitted to CMS in July, and throughout July and August, we had negotiations with them. So some of that was them just asking us questions or saying, you need to put this statement in there, things like that. And then on September 23rd, it was officially approved, which allowed us to cover these services as of October 1st of this year. And now I'm going to talk a little bit about the difference between being certified and being Access registered, because I know that's a little bit of a sticking point, and I think maybe contributes to some of the controversy that Lakeisha was alluding to. I think there was an understanding by some people that it was going to be a requirement to get certified to just provide doula services, and that they wouldn't be able to provide them at all if they weren't certified, which is totally not the case. Doulas still absolutely can legally provide services without being certified, but in order to be reimbursed by Access, there has to be that certification piece there. I suspect that's probably the same for private insurance too, but I can't speak as much to that. Now I'm going to stand up here so I can see this a little better. Oh no, I can't, can I? I'll stand on my toes. Oh, I can do that? Can you still hear me? Okay, so just a little bit of how each of these steps work into the other one. The first thing is that the doula has to be certified through ADHS. They share the different pathways for how that happens. And once they're certified, they're eligible to enroll as an Access provider. So again, to be reimbursed by Access, you need to be in the Access network. It's not that different from like private insurance, right? If you're privately insured, you check before you go to the doctor or another provider to make sure they're in network. And the first step to that is enrolling on our enrollment portal. And once that's approved, that allows you to see members of the American Indian Health Plan, AIHP, because again, those members have the freedom to see anyone in the Access network. Oh goodness, 1 minute, regardless of which plans they might be credentialed with. If you want to see any members other than AIHP members, you would credential with the individual health plans themselves, depending on what's relevant to where you're located and where your population is. And that's the link to the provider enrollment page. And then I think the next slide has a really quick screenshot of what that looks like. I'm not the expert in provider enrollment, but there is a lot more information on that page. I love that the mouse is going right there under user registration, because that's where you start for the first time. And there are many, many more resources there and people you can call and email addresses to get through the process. Couple things I'm just going to talk about as quickly as I can. That these were kind of controversial things about our policy too. So one of them is the requirement that there is a recommendation or referral from a licensed healthcare provider. And pointing out that legislative language as to the reason that is in there, I mentioned that CMS required that we put some language in there, and this was part of it. So in order for a service to be provided by someone that has a certification compared to a license, the services have to be recommended by a licensed provider. So that is a federal requirement. I'll also show you some of the state requirement there too. But one thing I want to highlight is that recommendation does not mean prior authorization. The plans are not going to require prior authorization simply to receive doula services at all. And that's a big long list of the number of different providers that could potentially provide this recommendation. All right, next slide. Medical necessity, another one that throws people, but another one that has legal requirements around it. Both of those quotes come from Arizona statute that access can only cover services that are medically necessary. But the definition of medical necessity is kind of broad. So you see prevent disease there. So that is right where doulas fall into. So we have to have that statement in there. But to be clear with our policy, medical necessity does not mean that members have to be at high risk or experiencing a complication. Just being pregnant or within that year postpartum is meeting the medical necessity. Services that doulas can provide, quoted the legislative language. These are the codes that doulas can bill for. There's one for prenatal and postpartum visits. These codes are based on 15-minute increments. Billing codes are set at a national level, and I'm being told to stop. Lakeisha told me to take one more minute. Okay. I'm gonna stand behind here. So anyway, that's the code for prenatal and postpartum visits. I don't know why it was set in 15-minute increments, but we expect that you're going to be billing more than that per visit. So you can go up to 2 hours per visit. If you need more than that, that's when prior authorization can potentially come into play. That other code right there, the per diem code, that's for the actual labor and delivery, which of course can vary tremendously based on how long that might take. And another question people ask a lot, is there a minimum or maximum number of visits? No, no minimum, no maximum, that's in our SPA. What else? Well, there was a slide with some links for more info, but I guess if you get the slides, that'll be in there. I think that's it, right? Okay, sorry, I went a little bit over.
All right, thank you so much, Rachel. Let's give it up for Rachel. That was a lot. It's a lot bringing everybody up to speed and on a level playing field as far as the information goes. I want to turn our talk to Amelia again, just to share some insight. I can remember back to my doula days, sleeping in chairs, sleeping in hospital bathtubs, staying up 48 hours plus, right, providing services and care for families. Why is it important that doulas are reimbursed fairly for their work?
Okay, so as a doula, this is my life. So I always like to give personal stories. I have children, I have bills, I have things that need to be paid. So as a doula, my passion is to help other women the way my doula helped me and change my whole career pathway. I did the traditional graduate from college, all that, and then doula where it came in, but it was like, how do you get paid for that? Like, how is there anybody that can pay unless you have a lot of money where you have money to pay for a doula? But the people that reached my heart so much didn't have that kind of money. So now that there's a pathway for us to get reimbursed, it's going to open so many doors for so many birthing people, for so many doulas who are passionate about this work. And in the end, I see the birth outcomes changing. And so it has a lot of ability if we can be compensated, even this way. And it gives a lot more access to people like me.
I agree so much. I'll share a personal story too with my twins who were my firstborn. I was helped by a doula, and that doula was provided by a hospital-based program. They had got a grant, and any person who wanted a doula could have a doula. And that's the way that I was able to receive one. That was 21 years ago. And here I stand now advocating for doula care for other families. So thank you for that, Amelia. Everything is real. it costs to be someone's doula. So recouping that is important. I think we heard from our lactation friends as well, providing these services to families that are most vulnerable and most in need is hard. So we are thankful for any program pathway that helps us reach those who need it most to gain access to these sorts of services. So I believe we have time for at least one question from the audience. Oh, we have lots of questions. I think I saw Eileen's hand first.
I just want to piggyback on what you said about I'm a postpartum doula. And when you think about our training, our insurance, our gas mileage, all the time in planning, promotion, we need to break even. And someone told me, you get 2 years, and after that, that's an expensive hobby. So we need to really look at it as a profession.
Yeah.
The second part of my question is more towards the Arizona level of this incredible thing that you've talked about. What about reimbursement for postpartum doulas, and is that on next year's agenda?
Okay.
That's already covered. The whole perinatal
I think to clarify a little bit,
timing.
Rachel, what if someone only does postpartum services? So not the birth postpartum combo, but only postpartum.
They can still be certified, right?
Yeah,
they-
you still have
yes,
to be
there's-
certified.
That's why she's asking. It was not specified on her slides.
And it's not specified on this document, it says.
Yes, it says birth only.
So to help clarify that question, if someone only provided postpartum services, could they certify as a doula and then apply for reimbursement for postpartum hours only? Do we know? And if we don't, that's okay.
No. There we go. All right. So for you being a postpartum doula, I am going to answer this in a very political correct way. If you meet the requirements, any of those requirements of the 5 pathway of life for a licensure for a doula, that's how you could obtain that licensure. And then you can use that certification to go ahead and bill through access.
And Rachel did say there's no maximum or minimum hours, right?
Yeah, the document is written from, so when the statutes are passed for a program, we form an advisory committee and we all work together to create the rules that reflect the statutes. So a lot of that verbiage and context comes directly from statute. And there's not a lot of just strictly postpartum certification in statute. So that's why it's listed as like birthing certifications or birthing, observation forms, things like that. But if you meet any of those requirements, you can apply for licensure.
And just in terms of decreasing maternal mental health, huge. There's enough research that follows along with the birthing.
Absolutely. Katie, your question?
Can you hear me? Yeah, okay, great. So, we've been investigating the potential of doulas to really solve this maternal mortality crisis. And so we have some questions about, like livable wage has come up as a concept a lot. And so I was curious, like, how were the rates set for how much doulas get reimbursed? And are there considerations for like doulas that are serving more like rural or tribal communities where they're having to travel far to see families? And then the other piece of it is, so like there's like stuff about like needing to have what's the word? Basically like mentorship to sign off to say that you've had your training under the supervision of someone who knows what they're doing. Is there compensation for, or is there any way that we can support people to serve as mentors and train? Because it seems like from our conversation so far that hasn't been a consideration.
So I'll answer the part about reimbursement. The mentorship part is all before you get to be an access provider, but so for the rates, the way rates are set is there's a code and then there's a rate for it. So there's not really a mechanism for I had to drive this far or I'm way out here. It's just kind of like this is what the code pays. For the labor and delivery code, that one that's in like a weird 15-minute increment, the rate that is set for that, this is all on our FAQ page, by the way. The rate that's set for that is I want to say $16.28. It's $16 and change, and that's per 15 minutes. So a visit is going to be more than that. And then the per diem code is 781 and change. And that's, in our state plan, that's on our fee for service rate. One thing to keep in mind is that health plans do have like some flexibility in setting their own rates just because of the nature of how Medicaid managed care works. Typically, they reimburse up to our rates. But that's the only reason I didn't include them on there is because if a doula, again, you're entering into a contract with the health plan, right? When you're credentialing, if it says something a little bit different, I didn't want there to be confusion. But those rates that we set for fee for service and are like proposed / kind of expected of our health plans are on our website. If the cents that I couldn't remember are super important.
Okay. I think the other question was around mentorship. Did someone want to handle that? And then Lindsay, did I see your hand up? Okay. Did our ADHS team want to speak to mentorship?
So can you ask your question again specifically about what you're wanting information on for mentorship? Is that in regards to some of the certification requirements? So specifically like the primary doula attestation that's asking for evaluations from the laboring mother or the letters of recommendation?
So the yes, I'm sorry. Yes, that's what I'm talking about.
So for those two specific things, so a primary doula attestation, which demonstrates serving as that doula for 3 births, it's a 1-page document that has the laboring mother's name. It will have the medical provider put their name and signature, and it just says, did the doula provide great services? Yes or no? And it's very simple. We tried to make it as easy as possible as the statutes would allow. So it's not like we're looking for someone to write you a review, and you're not seeking for this medical provider to spend 15 minutes with you filling out paperwork. We knew that that wasn't a realistic ask, and that also wasn't what the statute was asking for either. We just needed an evaluation. That's what the statute says. And so we were like, did they do good or not? Check mark yes, sign your name, move on. We tried to keep it really simple. So as far as mentorship, that's not really what the certification is asking for. And so we're not trying to push that avenue of, trying to really get underneath the wing of a medical provider.
I was reading through this before you guys started, and then the language is a little, high level. Yeah. I think maybe the one I was looking at was just about the experiential training or education. Is that? I thought there was something about attending at births, under this or participating. Maybe that's not.
No, for each of the pathways, it does say a completed and signed primary doula attestation for 3 births while serving as a primary doula, including evaluations from the mother and medical provider. But like I said, that's that 1-page form, yes or no, signature for each of them. And so when you were talking about the experiential training or education confirmation of completed core competency training, so these are pathways that we tried to nail out in a way that if you weren't certified through a nationally recognized doula organization, if you did have non-Western community doula training, that we provided an avenue for you to still become a state certified doula, even if you weren't going down these conventional educational pathways. So those other things are for people who can demonstrate that they have still specifically have competency in those other areas, that they're able to prove that they've got experiential training and that they do have the kind of experience that warrants a certification.
Thank you.
Yeah, it
Casey.
seems like that, I'm sorry, I'll stop, but I just wanted to clarify, like, maybe it seems like that's like a different area of where other forms of support are needed in terms of just connecting like potential doulas with mentors and training opportunities. Okay, thank you very much.
Thank you, Katie. We'll move to the next question, and then Bianna, I believe you were next.
Two questions, so these are based from my working with CNS in Maryland and DC. First question has to do around the time frame for reimbursements. In the other states I've worked with, sometimes there's a 3 to 6 month delay for reimbursement. So to ask that question, and then the second question is, do the doulas have to register individually, or can a collaborative sign up and the doulas work under the collaborative?
So for the reimbursement turnaround time, I don't know. That would be, I can give you a business card and I can try and find out what that looks like. I suspect the answer is it varies tremendously. Like, there are so many different plans, and, you know, if it's not coded quite right, then that could be a delay, or, you know, that kind of thing. What was your second question? I know I had an answer to it.
Doula collaboratives.
Right, okay, billing. So we have 2 different like provider types that could potentially work there. So the provider type we had to add to be able to cover these, the doula provider type, it's just called doula. Those are for individual doulas that will be, you know, billing themselves. If a doula group or doula collaborative wanted to bill like on behalf of their employees, they would register as a group biller. And so it's a little bit of a, you know, different scenario, but they would register as a group biller. All of their doulas would still have to be certified, and they would still have to be, you know, access registered providers that are connected to that group biller.
Fantastic, thank you. And then just for clarity, every certifying doula agency requires doula attestation forms. So we can go into the birth. If they are a certifying agency that requires in-person births, you have to fill out that exact same form for every single agency. If certifying agency, if you get certified, you have to fill out that form,
Yeah, that's true. Mhm.
just for awareness.
Bianna?
I've been following on the progress with getting to this point, with getting doulas certified, getting them to the point where it was back and forth. Do we certify? Do we not certify? What are the implications of that? And I'm trying to understand selfishly, from a lactation standpoint, how do we get to this point where lactation consultants are able to also qualify for being able to provide services without being under the label of a physician? Because currently, you have to have a physician to see the patient, and then you can only practice under them in order to get billed. Is it that we have to also go through a separate certification program in order for access to accept that our certification is legitimate?
So that is not the barrier at all to lactation coverage. And I don't know if your first part of that about being under a physician was maybe like a little bit private directed, because as you know, because you just gave a presentation about it, Access doesn't have robust lactation support coverage. Part of that is that we need funding appropriated to us for that. So if you don't work for a state government agency, that's something for you to know.
Do we have any virtual questions, Camille? So from our virtual community. And thank you, panel. You all have been on it so far, answering the questions.
So the question from the chat is, so the question is from Christy. She said, so if you become licensed to provide doula support through ADHS, you can be reimbursed for birth and or postpartum hours. Can you clarify that again? I just want to confirm.
Yes, if you are both certified and enrolled as an access provider and potentially credentialed with whatever plan. But yes, so those prenatal visits are covered, the labor and delivery is covered, postpartum visits are covered.
Awesome. And then another question is, will the requirement for neonatal resuscitation training remain, or are there any resources to access that training?
That is a great question. So the doula program, so there's a lot of requirements with rules. Because the doula rulemaking was expedited, it requires a 1-year rule review. And that timeframe just recently came. So we have reviewed the rules throughout that time. So basically, whenever we start a program, our program has 8. We just transferred one, I think 7 programs right now underneath it. And with that, I'm just saying that because when people call in or when we get emails or feedback, we save that feedback in the drive under that specific program file. And then when we approach either a 5-year rule review or a 1-year rule review, we review that information and look at the rules specifically. For example, this exact situation, the neonate resuscitation requirement. That has been known so far. We've had a lot of feedback that that's been a burden. We got that feedback when we did the 1-year review. We looked at that. We double checked in statute. It was not a statutory requirement. It was included. It was something that we discussed with the advisory committee. It was something that was actually in the midwifery rules. And a lot of the feedback from the public and from the advisory committee and even from us internally was that this would be a wonderful extra caution to have, right? To have this certification, if something were to happen, that you would be able to provide that service to that child, right? But the more that we heard that this is a barrier, that it's very hard to come across this training, it's also expensive. We realized, okay, a doula is not going to be the one birthing the child, like providing the birth. They're assisting. And there's going to be a midwife, a medical provider, so on and so forth there. So those individuals would have that neonate resuscitation certification. So let's take that out. So long story short, in our draft for the revised rules for that 1-year review, we did strike that requirement. We are actually in the process, it should be within about 2 weeks. That rule draft will be provided. It's actually within DHS, but it's on our Administrative Council and Rules webpage. And if you go there and you look at active rulemakings, it's not there now. It will be there probably within 2 weeks. You can click on active rulemakings, you select doula, you can see what is this 1-year what is this 1-year review? What does this entail? You can see the draft link as well as the online survey. Now, let me just clarify. When we do provide that draft, we email all of our stakeholders related to doulas, all of our active licensees, and anybody else that has kind of flagged that they'd like to have those notifications. And we let them know through a Gov delivery email that the rule drafts are now available on Administrative Council and Rules website, as well as the link to the online survey, which would be available for 2 weeks. And you can provide your feedback directly from the rule drafts within there. And then we go back to the drawing board, we look at all that feedback, and then we look at the rules and see, can we add any of this feedback? Are there statutory requirements that kind of restrict us from being able to do some of that feedback? A lot of times people will share their frustrations of why didn't you use my feedback? But again, it is always back to statute that we have to look at. So I hope that in a very long-winded answers that question. It was a great question.
Well, what an amazing example of when we use our civic power to speak up and say, we don't think that this is right. So thank you for sharing that. And I know a lot of birth workers that are going to be very happy to hear that news because they were kind of upset about that. But so again, great example. Wonderful, wonderful sharing of information here. Can we please give it up to our panel for being brave and open and sharing their knowledge? I hope this makes clear a lot of issues around our Arizona doula rollout and certification program. In our last few seconds, does anybody have any burning comments about what's next? Like what do we foresee happening in next steps around our certification program or our reimbursement process?
Two of the items that I'd like to highlight, which were actually mentioned during this session, is that's a big win that DPS is going to have that option when you apply for your fingerprint clearance card. Like I said, that should be happening from the timeframe they provided to us, then end of this week or following week. But
Okay.
I do believe that they are going to keep with that timeframe, and we're very excited about that. And then the other is that 1-year rule review draft should be available on Administrative Council and Rules website within 2 weeks. So we really value that feedback, and so we will be sharing that with all of our advisory committee members, stakeholders, and our active licensees.
Awesome.
I think from the, access perspective, I think that is going to in turn affect, how we can bring this service to members. Because again, that first step is being certified. And this was holding up, I think, a lot of people that wanted to be certified but had that barrier. So once that happens and we start getting more certified providers, and they can enroll as access providers, it's going to actually bring this service to our members, which is of course the whole point.
Absolutely. Thank you all so much. Let's give it up for our panel. Everybody shared contact information. So if you have more questions or more in-depth questions, don't be afraid to reach out and get the information that you need in order to serve yourselves or our communities. So thank you all for being here. I believe it's break time.